You may notice that my face looks a little different than normal. It's not going to stay this way forever, but I thought I'd kind of tell you how it got this way. There was skin cancer on the side of my nose, right here, and looking back in pictures over years, yeah, it was there and it slowly grew, and about for the last 8 months, 10 months, it started opening up and bleeding and stuff like that, which is when we started to take it serious and got it checked out. I was referred to a dermatologist who referred me to a surgeon. They did a biopsy. It was basal cell carcinoma, which is skin cancer, the third kind of skin cancer. It's local and non-destructive and non-life-threatening. Basically, they freeze your nose and scrape the cancer out. They just keep going until they think they've got all of it, and then they take those layers that they've scraped out and they look at them under a microscope, determine if they've got everything, and if they don't, then you go back in. So I waited about 2 hours for them to call me back in for a second round of scraping. Both times that they do it, they cut it out and then they cauterize the inside, so you have to smell your own burning flesh. And I took a selfie, and I'll show you. And this one's kind of gross, so if you get squeamish, don't look at this one. I'll let you know when you can open your eyes, but I'll put it on the screen. Basically, they dug out a hole on the side of my nose. It was quite large and rather red, obviously, and they cauterize it, and then they send you back out with a bandage on your nose. You can look again if you don't want to see it, so it's off. Then I waited for 2 hours, went back in because they didn't get all of it, and then they had to scrape more out, and then there was more that they had to take out. The picture I showed you was after the second one. The nurse wasn't so pumped that I was taking a selfie. She was like, "You shouldn't really look at it." Then we were under the impression that the next day, the Thursday, we'd be having reconstructive surgery on my face. However, the hole was so large that they decided that they needed to get it done immediately. So even in between the first and second scraping, they called the plastic surgeon and said this has to happen today, and they pushed for it to happen today. And so I went to St. Boniface Hospital. I realized they were in a rush to get me in. I guess the outcome of the surgery is pretty dependent on how fresh the wound is, I imagine. Because as soon as I arrived, they ushered me right into the prep room, and I was changed, got my needle in for the IV, signed the waiver. Doctor was there, anesthesiologist was there, everybody was right there, ready to go. They explained it to me and whisked me off to the operating room. And then all I remember from that point forward was waking up slightly in the recovery room and asking for more painkiller, and then waking up in my own room sometime later that evening. I felt terrible, like I'd been run over. You can see a picture of what I looked like after the surgery. And then I tried taking like one sip of water, and that triggered the vomit. And so I vomited a lot that night while they tried to juggle switching painkillers from morphine to something else and switching the anti-nausea medication then as well. Tried to go to the bathroom at one point before the night and almost fainted in the washroom, so I wasn't allowed to do that anymore. And in the morning, a lot felt better. I felt way healthier, and I looked better. I had the strength to get up to go to the bathroom, and yeah, they let me home that day after T3s. I'd had T3s and a bit of food, and they had stayed down, and so I was allowed to go home. Now, onto the nose. You may be wondering why it looks so weird. This is actually not even the worst. This is probably the best angle right here, at which point it looks just like a swollen nose. The weirdest though is if I continue all the way over here, or especially go the other way and show you that side. You might be wondering why the heck it looks so weird and why they would do this. Basically, there was a giant hole on my face, on my nose, and they needed to fill it. And they needed tissue that could stay alive, and you can't just plunk tissue down in there and stay alive. So they take your forehead and they cut a pretty wide stretch. You can see how wide it is right here. From here all the way to here. That's how much forehead they cut in a straight line, and it's that thick the whole way up. Oops, here we go. It's the whole way up. It's that thick. So about here, they roll that extra skin, because it's wide, underneath, and form it into a little tube. They don't quite have enough to make it go all the way around, and so the other side here, where it looks even grosser, that's actually skin from my thigh. Basically, they potato peeler your thigh, take off the top layers of skin, stick that in there, roll into a tube. For the first 4 days, we had no idea that it was actually skin from my thigh. We couldn't figure out where. I knew I had stuff taken from my thigh because there's a big bandage there and it hurts, but I didn't know where it was, and we thought that was like, I don't know, some plastic tube or something. It wasn't red at the beginning, it was pretty white. It's redder now. So they take that stretch of skin, fold it over, and stitch it onto here. It's going to stay that way for 3 weeks because it needs to the blood supply to make it to the nose here to keep it alive. It wouldn't stay alive if it was isolated. So they need the blood supply, while from underneath it needs to reattach to my nose. In my entire long explanation, I forgot to mention one of the funniest and coolest things. This is skin from my forehead. It is still attached where it's supposed to be attached, meaning that when I touch here, I feel it up here. As I move my hand, it just simply feels like someone is stroking my skin back and forth. It is a very odd feeling, and at the beginning was quite unsettling. I'm getting used to it now. The weirdest part of it is when I drink a glass of water, I'm drinking, and if I bump my nose at the top of the cup, it feels like someone's whacking my forehead, and every time it gets me, I'm like, ah, what's going on up there? Random, funny. It makes logical sense, but it still is kind of weird. That feeling will be gone when they cut away the bridge, a process which I'll describe in the video in just a minute. So then they take your forehead, which is now a good 3/4 of an inch of a hole, and they pull it together and they stitch it together. So for about the first 4 days I had headaches from the tension, but they've more or less gone away. I can still feel the tension there. And so this is called the bridge that's supplying the blood for my nose on this side. They are going to cut that out in about 2 weeks or 3 weeks from the surgery, give or take. It's not sure yet. They'll cut it off at the top here and wherever they don't need anymore to cover the hole, and they're going to get them. The bridge is gone, and they'll just re-sew that skin where it needs to be. And then they'll sew the hole up there, and it will continue to heal. And then eventually, from everything I've heard, that will be gone. It will, maybe if you look closely, there'll be scars, but it should look relatively normal. So yeah, that's basically what's going on.